Learning medicine is hard work. Osmosis makes it easy. It takes your lectures and notes to create a personalized study plan with exclusive videos, practice questions, and flashcards, and so much more. Try it free today.
Tetanus means being taught, which is a good description of the disease caused by bacteria called Clostridium tetani. Clostridia, as a family, are obligate anaerobes, meaning that oxygen is toxic to them. In nature, they thrive in deep, compact soil, and when they feel the stress of fresh oxygenated air, they often produce spores, which are metabolically inert and extremely resilient to the environment. Then, when environmental conditions improve, the spores are able to sprout into fully fledged Clostridia. When doing a gram stain, Clostridium tetani stains purple, or gram-positive, and it's a bacillus, meaning that it looks like a big cylinder or rod under the microscope. Clostridium tetani is notorious for one of its toxins, called tetanospasmin, which can severely disrupt the neuromuscular system of mammals. Tetanospasmin works by entering special inhibitory neurons called Renshaw cells. Once they get inside, tetanospasmin cleaves snare proteins, which are proteins that pull vesicles that are loaded with neurotransmitters to the neuron membrane. When the snare proteins are cleaved, it prevents the release of inhibitory neurotransmitters, like glycine and GABA. You can think of snare proteins as the rails, and the vesicles as trains that are loaded with neurotransmitters. The tetanospasmin destroys the rails so that the trains can't move. The role of Renshaw cells and inhibitory neurotransmitters is to fine-tune the action of the alpha motor neuron, which is in charge of sending the actual signal for contraction to the muscle. In tetanus, Renshaw cells fail to work, and the alpha motor neuron keeps firing without any inhibitory control, causing muscle rigidity and spasm. Spores of Clostridium tetani are most often introduced into the body through penetrating trauma, like a puncture wound. Puncture wounds are usually anaerobic and warm, and are therefore optimal for growth of Clostridium tetani. And an important point is that Clostridium spores can get introduced from dirty wounds, like a rusty nail, as well as clean wounds, like a recently washed kitchen knife. In fact, any kind of puncture wound or cut brings along the risk of tetanus. Tetanus usually starts with a delayed onset, about a week to a month after the initial injury. In the most common form of tetanus, called generalized tetanus, the spasms begin in the face muscles, most notably the lower jaw, and from there the spasms spread throughout the body. The spasms are sudden, powerful, long-lasting, and very painful contractions of muscles. These contractions are so powerful that they can result in muscle tears or bone fractures. The classical tetanic triad of symptoms involves trismus, or lockjaw, which are mild to severe spasms of the lower jaw, rhesus sardinicus, or Sardinian grin, which is an abnormal-looking sustained grin caused by facial muscle spasm, and opisthotonus, which is a severe spasm of all muscles in the body simultaneously, resulting in a high arched back and patient resting on his heels and the back of his head. Tetanus only affects skeletal muscle, so smooth muscle and cardiac muscle continue to function normally. Other symptoms of tetanus involve sympathetic overactivity, which causes drooling, excessive sweating, fever, difficulty swallowing, breathing problems, and irregular urination and defecation. Rarer forms of the disease include the local tetanus, where a persistent spasm will be only localized around the area of the injury. This condition persists for a few months, but will gradually subside, with less than 1% mortality. Even rarer is the cephalic tetanus, which is limited to the muscles supplied by the 12 cranial nerves only. This can happen in the case of head trauma, such as skull fractures, eye injuries, middle ear infections, and sometimes even from tooth extractions. Cephalic tetanus is more likely than other types to cause death. There's also neonatal tetanus, which happens to newborns of mothers that have not been immunized against tetanus themselves. If the umbilical cord is cut by a non-sterile instrument, the newborn can develop highly lethal neonatal tetanus. Newborns of immunized mothers are protected through passive immunity, and hygiene standards have been improved even in the developing world, so the umbilical cords are usually cut with sterile equipment. The diagnosis of tetanus is based on the clinical appearance. One clinical test is called the spatula test, and it involves touching the posterior pharyngeal wall with a wooden spatula and observing the effect. A positive test results in involuntary contraction of the jaw, or biting down hard on the spatula, due to the lower threshold for muscle spasm in patients with tetanus. A negative test result would be a normal gag reflex. Tetanus toxin can also be found in the serum using a bioassay. Finally, culturing Clostridium tetani is very difficult because anaerobes are notoriously difficult and slow to grow. Tetanus is usually treated with tetanus immune globulin, or TIG, which is an antitoxin that binds to circulating tetanospasmin. In addition, muscle relaxants, pain medication, and other supportive care measures are taken while the immune system clears the infection. Full recovery can take a few months of intensive care, as the body's neurons slowly heal. Fortunately, tetanus infection can be prevented with the tetanus toxoid vaccine. Vaccination generates active immunity by injecting weakened or dead versions of the disease agent into the body. Tetanus vaccines in childhood and adolescence are given in the form of a triple vaccine that covers diphtheria, tetanus, and pertussis in a single jab. Alright, as a quick recap, Clostridium tetani is a sporulating, gram-positive bacillus anaerobe that makes the toxin tetanospasmin, which causes tetanus by disrupting the release of inhibitory neurotransmitters from Renshaw cells. Tetanus comes in 4 clinical types: generalized, local, cephalic, and neonatal. Tetanus is characterized by powerful, violent muscle spasms, summed up by trismus, or lockjaw, rhesus sardonicus, a persistent grin, and opus thotinus, a highly arched back with patient resting on his head and heels. Treatment of tetanus involves application of tetanus immune globulin and supportive care measures. Finally, tetanus vaccine immunization can prevent the disease.
Thanks for watching. If you're interested in a deeper dive on this topic, take a look at osmosis.org, where we have flashcards, questions, and other awesome tools to help you learn medicine.
Tuberculosis. Tuberculosis is an infectious disease which is communicated from one person to another directly or indirectly. It can also be contracted from animals like cattle. It is caused by the bacteria Mycobacterium tuberculosis, which was first identified by the German scientist Robert Koch. It usually affects the lungs. It may also affect other parts such as bones, lymph glands, alimentary canal, liver and kidneys. Mycobacterium tuberculosis releases a toxic substance called tuberculin. TB spreads by inhaling infected droplets released through coughing, sneezing, talking and spitting by the patient or by drinking infected milk. The bacteria grows in the infected person's lung cells. They get surrounded by the neighboring cells, forming a nodule or a tubercle, a rounded mass of cells in the lungs. These nodules cause the neighboring tissues to break down, thus forming small cavities. These spread to the upper part of the respiratory tract, eroding the blood vessels. Blood comes out with the sputum when the patient coughs. The sputum and the droplets contain the bacteria. Milk from infected cattle contains this bacteria. Drinking the milk without boiling can infect a person with the TB bacterium. TB can affect all parts of the body like lungs, lymph glands, bones, brain, intestine, etc. The incubation period of TB includes a few weeks to a few years. Symptoms: mild fever, sweating at night, blood in the sputum, fatigue, loss of appetite and weight. The symptoms may vary on the basis of the type of TB. The 2 types of TB and their symptoms are as follows. Lung or pulmonary TB. The symptoms including continuous cough and blood-stained sputum, loss of weight and weakness, chest pain and breathlessness. The bacteria causes local inflammation of the lungs and produces an abscess. This usually heals up, leaving a scar tissue, which shows up in X-rays. Lymph gland TB. The symptoms include swelling and tenderness of the lymph glands, often in the legs, which may discharge through the skin. Prevention. Vigorous public health measures. Isolation and proper rehabilitation of the patient. Children should be immunized with BCG. Bacilli Comet Guerin vaccine. People should be made aware of the harms of indiscriminate spitting in public places. Avoiding overcrowding, provision of good ventilation, and better nutrition help to reduce the incidence of the disease. Control. The diagnosis of tuberculosis is made on the basis of positive tuberculin test, chest X-rays, positive sputum, gastric analysis, etc. This is not a hereditary disease. Modern treatment of tuberculosis is based on 6 main factors, namely rest, diet, drugs, surgery, rehabilitation, and health education. TB can be controlled by drugs, namely rifampicin RMP, INH, streptomycin, pyrazinamide, ethambutol, and thioacetozone.
Pneumonia is inflammation in your lungs caused by an infection. You have 2 lungs, one on each side of your chest. Each lung has separate sections called lobes. Normally, as you breathe, air moves freely through your trachea or windpipe, then through large tubes called bronchi, through smaller tubes called bronchioles, and finally into tiny sacs called alveoli. Your airways and alveoli are flexible and springy. When you breathe in, each air sac inflates like a small balloon, and when you exhale, the sacs deflate. Small blood vessels called capillaries surround your alveoli. Oxygen from the air you breathe passes into your capillaries. Then carbon dioxide from your body passes out of your capillaries into your alveoli so that your lungs can get rid of it when you exhale. If you have pneumonia, your airways or lungs have an infection caused by germs, such as bacteria, viruses, fungi, or parasites. Your airways catch most germs in the mucus that lines your trachea, bronchi, and bronchioles. Hair-like cilia lining the tubes constantly push the mucus and germs out of your airways, where you may expel them by coughing. Sometimes germs make it past your mucus and cilia and enter your alveoli. Normally, cells of your immune system attack these germs, which keep them from making you sick. However, if your immune system is weakened due to age, illness, or fatigue, pneumonia-causing germs can overwhelm your immune cells and begin to multiply. Your bronchioles and alveoli become inflamed as your immune system attacks the multiplying germs. The inflammation causes your alveoli to fill with fluid, making it difficult for your body to get the oxygen it needs. If you have lobar pneumonia, one lobe of your lungs is affected. If you have bronchopneumonia, many areas of both lungs are affected. Pneumonia may cause the following symptoms: difficulty breathing, chest pain, coughing, fever and chills, confusion, headache, muscle pain, and fatigue. Pneumonia can lead to serious complications. Respiratory failure occurs when your breathing becomes so difficult that you need a machine called a ventilator to help you breathe. Bacteremia occurs when the bacteria causing your pneumonia move into your bloodstream, where they may travel to infect other organs. In some cases of pneumonia, a large collection of fluid and pus, called an abscess, may form inside one of your lungs. If an abscess forms around the outside of your lung, it's called an empyema. Possible treatments for pneumonia include antibiotics, if the cause is bacteria or a parasite, antiviral drugs, if the cause is a flu virus, antifungal medication, if the cause is a fungus, rest and drinking plenty of fluids, and over-the-counter or OTC remedies to manage your fever, aches, and pains. If you have severe pneumonia, you may be admitted to the hospital and given intravenous antibiotics and oxygen.